Greensboro Area Health Education Center is one of 9 centers in the statewide North Carolina AHEC program system with a history of excellence in healthcare professional education delivered with the highest customer service. We are dedicated to improving the healthcare of North Carolinians by providing quality education and information support to healthcare professionals in our 8-county region. Our multi-professional team of skilled education specialists help you assess your needs, identify problems that affect your productivity and patient care outcomes, and find creative educational solutions tailored to your business objectives and resources. It is an increasing challenge for today's healthcare professional to stay up to date in a fast-paced, rapidly changing clinical and technological environment. Greensboro AHEC offers opportunities for lifelong learning by providing a wide variety of fully accredited continuing education workshops led by recognized authorities on the latest developments in healthcare.
I would say that Greensboro AHEC offers quality programming. It's excellent, it's fun, it's engaging. They always provide something that's meaningful to the participants. I would encourage everybody to look at the Greensboro AHEC website, call Greensboro AHEC, attend one of their activities. You won't be disappointed.
Our reputation for customer service and our expertise in events management allows us to partner with your healthcare group or association to alleviate the stress of conference management. We are equipped to assist with all aspects of conference management, including facility service contracts, catering, audiovisual services, exhibitions, contracting with speakers and supporting their needs, handling registrations, publicity, and providing continuing education credit. When you partner with us to manage an event, you increase your chances for success.
We started the Trauma Symposium, which is named Key Issues in Trauma Management, approximately 13 years ago, right after I arrived at Cone Health, which back then was Moses Cone Health System. Immediately, AHEC came to my assistance to help me sort of organize a program, get sponsors, find a place for it. It was a tremendous amount of help. Extremely professional, well organized, always very thoughtful, looking out for our interests in addition to those that will be attending our symposium. It's not just that though, they've also helped us organize CME credits and activities surrounding our peer review process, which is extremely important because it helps to provide education for those that come to those peer review meetings and also provide credit for them as an incentive to continue to participate in these types of activities.
With the changing times and technologies, multimedia production continues to evolve at Greensboro AHEC. We can capture your classroom presentation electronically for distribution online or on a DVD. We can work with you to storyboard your own content for simple or complex digital video production. Our team of professional designers and photographers, equipped with a state-of-the-art digital production studio, can turn your vision into reality. They're very professional, very easy to work with, full of great ideas, and the final product is always delivered on time and makes me look good. What more can you ask than that? Many providers find they learn best away from the stresses and interruptions of their clinical environment. HEC Connect is an internet-based system that lets you take accredited courses online when and where it's most convenient. Register on our secure site and have immediate access to content created by recognized subject matter experts in all healthcare disciplines. Access online certificates for your transcript record when the activity is completed. Our online instructional designers also specialize in helping other healthcare organizations develop or host their online content on custom web portals.
Well, we utilized HEC Connect. We were doing trainings face-to-face throughout the state in 2008, but we realized that we weren't reaching everyone that we potentially could reach, and we knew that online was the way to go. So that's how we got connected to Karen. Oh my goodness, it's really astounding. I checked just before I came this morning, and over 25,000 providers have registered for our courses. There are about 7 courses. All of them, every one of them, produced by AHEC Connect. So I have 25,000 individuals, and throughout North Carolina, over 4,000 have registered for us. So, and they're from 98 of the 100 counties, and nationally from a third of the counties. So it's just been a spectacular success for us.
Many times the best educational experience is just the right information at the right time. Access to hundreds of full-text electronic textbooks and journals, and online access to the reference services of trained clinical librarians is another way Greensboro AHEC can help you at your point of need.
I would tell them that it's invaluable to my job. There is no way that I could care for my patients in the way that I do without the benefit of Peggy. And I specifically refer to her, but with the AHEC librarians, they enable us to drill down the volumes and volumes and volumes of literature out there and really get what we specifically need, and so that we're able to take care of our patients. You know, bottom line, we want to operate by best practice. And they enable us to do that because we're able to find it so much faster, and just, it's right there at our fingertips. Print it out immediately from her emails. It's great.
Our Health Careers team aims to improve the supply and distribution of the healthcare workforce and to increase minority representation in health professions in North Carolina.
Well, I am a new resident to North Carolina for 2 years, and I love this state, and I would encourage people entering healthcare to investigate this program if it is what they're needed in that situation, as it was in mine, to re-enter and have the training. It's an excellent program, and it provides the much needed skills and time spent and education to really give back to the community, because now I work in a rehab unit as a nurse. The program moved quickly for me. I was motivated, and so I'm able to give back by caring for people in our community.
Targeted programs are implemented throughout the year to support elementary through high school students on their path into a healthcare career.
It's given me a broader perspective of the health careers. There are so many that I never really thought about. Like, I never really considered dentistry as a health type of thing, but it is when it comes to your teeth. And it was things about how everything's important. Like, we visited the morgue and we got to see what cancer looks like. Miss Parrish is really, really nice. Like, my mom passed away a year ago of cancer. And, like, people from the club, they wrote me letters, you know, they're like, I'm sorry for your loss, and they're really nice to me and sent me a plant. So it's not just like a community or people you meet once a month. They're really friends, and that says something if you can see somebody once a month and they really care about you.
Since 2006, Greensboro AHEC Center for Quality Improvement, previously known as the Regional Extension Center, has been providing assistance to primary care practices in an effort to improve the method and care they deliver to their patients. Strategies have included integrating quality improvement and data collection methods into daily activities, recognizing opportunities to improve efficiency and satisfaction for both patients and the healthcare team, incorporating population-based approaches for care management and the adoption and implementation of electronic health records to further improve and sustain quality outcomes and improve the safety of clinical care. These efforts, along with strong teamwork, a motivation to improve, and the coordination of care, leverages many primary care practices in becoming the patient-centered medical homes of the future. Greensboro AHEC, CQI, provides services to more than 150 practices and 700 providers.
They've been really, really helpful. We're becoming a patient-centered medical home, so that's an extremely large process, and we're a private practice, so we don't have the resources that the major hospitals do. So Mary Ann Evans has been our contact for most of this, and she comes and meets with us and helps lay it out in a way that we can understand and then implement to improve our quality measures, which then improves our patient care and improves our compliance.
AHEC supports the excellent Cone Health AC GME accredited programs, including the family medicine, internal medicine, and sports medicine teaching programs. These fully accredited primary care programs graduate 18 residents and 2 fellows annually. More than half of these graduates stay in North Carolina. Our pediatric program serves as a major teaching site for the University of North Carolina at Chapel Hill.
What a positive experience this has been for those of us who are going through the residency program. The staff and faculty here have been very supportive. They're very compassionate both towards the patients and towards guiding us and mentoring us and getting us towards our career goals. A lot of it's behind the scenes. I don't think our patients necessarily see how our attendings interact with us or how we are able to interact with one another, but it truly is a family feel in the internal medicine residency program, and it's been a fantastic experience for me.
I was actually born at Moses Cone Hospital, grew up in Greensboro, took a little bit away at UNC Chapel Hill for college, and then I went to medical school in England. Afterwards, it was kind of an easy decision to come back home to Moses Cone for residency, which I started in 2009 with the family medicine program. That lasted a wonderful 3 years. It was very busy. We were very, very well prepared for future practice, from delivering babies on a Monday to injecting joints on a Friday and seeing patients in the afternoon all through the week. So I finished that in 2012 and then went on to the Sports Medicine Subspecialty Fellowship. If you are going to get care, you want to get care where the training is absolutely the best. Trainees from the Area Health Education Center programs are extremely well prepared. I had no qualms, no issues, no uncertainties when coming into practice, and I can relate that to my training.
Greensboro AHEC is your partner in continuing professional development and lifelong learning. We meet the needs of our constituents by managing conferences and events across the state and bringing the information that you need directly to where you are through online education and multimedia production. Greensboro AHEC is dedicated to supporting the growth and development of the healthcare workforce and improving healthcare quality, safety, and efficiency. Learn more at www.gahec.org or call us at 336-832-8025.